About Quetiapine brand names: Atrolak, Biquelle, Seroquel, Sondate. Zaluron. Quetiapine is a medicine that helps with mental health conditions such as schizophrenia, where you may see, hear or feel things that are not there, where you believe things that are not true, where you feel unusually suspicious, or have muddled thoughts. The mania symptoms of bipolar disorder, where your mood changes between feeling highly excited mania and very low depression. Depression in bipolar disorder. Depression. Quetiapine is only used together with other medicines for depression. It can help to prevent mania and depression if you have bipolar disorder. It's an antipsychotic medicine that works by affecting chemicals in your brain such as dopamine and serotonin. It does not cure your condition, but it can help with the symptoms. Quetiapine is only available on prescription. It comes as tablets, including slow-release tablets. These may have Excel in the brand name, and as a liquid that you swallow. Key facts: Quetiapine does not work straight away. You'll usually start on a low dose. It can take several days or weeks to get to the right dose for you, and for your symptoms to start improving. You can take Quetiapine standard tablets in liquid with or without food. If you're taking the slow-release tablets, take them on an empty stomach. This means an hour before food and 2 hours after food. Common side effects include feeling sleepy, problems with your movement, and headaches. Quetiapine can make you feel more hungry than usual, so you may put on weight. Eating a healthy, balanced diet will help with this. It's best not to drink alcohol for the first few days of treatment until you see how the medicine affects you. Do not have grapefruit or grapefruit juice while taking this medicine, as it increases the risk of side effects. Who can take Quetiapine? Most adults aged 18 years and over can take Quetiapine. Who may not be able to take Quetiapine? Quetiapine is not suitable for some people. To make sure it's safe for you, tell your doctor before starting to take it. If you have ever had an allergic reaction to Quetiapine or any other medicine, have a heart problem such as an irregular heartbeat, rhythm, have low blood pressure, hypotension, have had a stroke, or are at high risk of having a stroke, have ever had problems controlling the movements of your tongue, mouth, and face, have ever had a rare condition called neuroleptic malignant syndrome. Symptoms include a high temperature, muscle stiffness, sweating, anxiety, and excess saliva, have Parkinson's disease or dementia, have ever had low levels of white blood cells, have diabetes, have epilepsy, or have ever had a seizure fit, have liver problems, have had a blood clot, or someone else in your family has a history of blood clots, have ever had sleep apnea, where you stop breathing for short periods during sleep, have ever had a condition where you cannot completely empty your bladder, urinary retention, have an enlarged prostate, benign prostate enlargement, have eye problems such as glaucoma. How and when to take Quetiapine? It's important to take Quetiapine as your doctor tells you. Dosage and strength: standard Quetiapine tablets come in strengths of 25 and 100, 105, 200 and 300. The slow-release tablets come in strengths of 5, 105, 200, 300, 400 and 600. The liquid contains 20 of Quetiapine in ml. How much Quetiapine you take depends on why you're taking it. Your doctor may ask you to change your dose, depending on how well Quetiapine works for you. It can take a few weeks to get to the dose that works best for you. Doses may be lower for older people and people with liver problems. Dose for schizophrenia: you usually start on a low dose of 5 a day when taking standard tablets. This will be increased over a few days to start with. Your doctor may advise you to slowly increase your dose even more, depending on how well Quetiapine works for you. Most people feel better with a daily dose of 300 to 600. If you're taking standard tablets, take half your dose in the morning and half in the evening, unless your doctor gives you different instructions. If you're taking slow-release tablets, take the whole daily amount in one dose. Dose for mania symptoms of bipolar disorder: you'll usually start on a low dose of 100 a day when taking standard tablets. This will be increased over a few days to start with. Your doctor may ask you to slowly increase your dose even more, depending on how well Quetiapine works for you. Most people feel better with a daily dose of 400 to 800. If you're taking standard tablets, take half your dose in the morning and half in the evening, unless your doctor gives you different instructions. If you're taking slow-release tablets, take the whole daily amount in one dose. Dose for depression and bipolar disorder: you'll usually start on a low dose of 5 a day. This will be increased over a few days. Most people feel better with a daily dose of 300. Take it once a day at bedtime. Dose for preventing mania or depression in bipolar disorder: if you've taken Quetiapine to treat bipolar disorder and it has worked for you, you'll usually continue to take the same dose. Your doctor may ask you to increase or decrease your dose to find the best dose for you. Most people continue to feel better with a daily dose of 300 to 800. If you're taking standard tablets, take half your dose in the morning and half in the evening, unless your doctor gives you different instructions. If you're taking slow-release tablets, take the whole daily amount in one dose. Dose for depression: when used with other medicines, you'll usually start on a low dose of 5. This will be increased over a few days. Most people feel better with a daily dose of 115 to 300. Take it once a day at bedtime. How to take tablets. If you're taking standard tablets, swallow them whole with a drink of water. You can take them with or without food. If you're taking slow-release tablets, swallow your tablet whole with a drink of water without food. It's best to take the tablets at least 1 hour before a meal and at least 2 hours after a meal. Do not break, chew or crush the tablets. How to take liquid. If you're taking liquid Quetiapine, it will come with a plastic syringe or dosing cup to help you measure out your dose. If you do not have one, ask your pharmacist for one. Do not use a kitchen spoon as it will not measure the right amount. If your Quetiapine liquid comes in a bottle with a syringe, shake the bottle. Remove the cap and push the syringe adapter into the bottle neck. Put the syringe into the opening in the adapter and turn the bottle upside down. Fill the syringe to the right dose. Turn the bottle the right way up and remove the syringe. Put the end of the syringe into your mouth, and push the plunger to squirt the medicine into your mouth. Swallow your dose straight away. Have a drink of water afterwards if you need to. Wash the syringe and let it dry before you use it again. To use the dosing cup, shake the bottle. Then pour the liquid into the cup until it reaches the mark shown for your dose. Wash the cup and let it dry before you use it again. You can take the liquid with or without food. How long to take it for? If you take Quetiapine for schizophrenia or depression, you may need to take it for a long time, maybe several years. If you take it for mania or depression and bipolar disorder, you may need to take it for a few weeks or months. Your doctor may suggest that you keep taking it for a long time, maybe several years, to stop your symptoms coming back. Important: keep taking Quetiapine even if you feel better. Do not stop taking it without talking to your doctor. If you forget to take it, if you forget to take a dose of Quetiapine, and you usually take it once a day, take the missed dose as soon as you remember, unless it's less than 12 hours until your next dose. In this case, skip the missed dose and take your next dose at the usual time. If you forget a dose and you usually take it twice a day, take the missed dose as soon as you remember, unless it's less than 8 hours until your next dose. In this case, skip the missed dose and take your next dose at the usual time. Do not take 2 doses at the same time to make up for a forgotten dose. If you miss 2 or more doses, contact your doctor. If you often forget doses, it may help to set an alarm to remind you. You could also ask your pharmacist for advice on other ways to help you remember to take your medicine. Stopping Quetiapine. Do not stop taking Quetiapine unless your doctor tells you to, as your symptom may come back. If your doctor asks you to stop taking this medicine, your dose may be decreased slowly over a few days. If you reduce your dose too quickly, you may get withdrawal symptoms such as feeling or being sick, nausea or vomiting, sweating and problems sleeping. Talk to your doctor if you have any problems when you reduce your dose or stop taking Quetiapine. Side effects of Quetiapine. Like all medicines, Quetiapine can cause side effects, although not everyone gets them. Common side effects. These common side effects of Quetiapine may happen in more than 1 in 10 people. There are things you can do to help cope with them. Feeling sleepy during the day, problems with your movement, headache, feeling dizzy, putting on weight, or changes to your appetite, constipation, swollen breasts, pain in your breasts, or leaking breast milk, irregular periods, or stopped periods, fast heartbeat. Speak to a doctor or pharmacist if the advice on how to cope does not help, and a side effect is still bothering you or does not go away. Serious side effects. Serious side effects are uncommon and may happen in up to 1 in 100 people. Speak to your doctor or call 111 now if you get twitching or jerking movements that you cannot control in your face, tongue, or other parts of your body. Infections, such as cold or flu symptoms, high temperature, or ear, eye, bladder or chest infection, swelling, pain, and redness in your leg. This may be a sign of blood clots. Serious allergic reaction. In rare cases, it's possible to have a serious allergic reaction, anaphylaxis to Quetiapine.